The Angels of Death. Hello, I'm H.G. Tudor. Just recently you have been enlightened by my forensic analysis of Lucy Letby, her various behaviours, relationships and conduct, culminating in a fascinating dissection of what she is and why she killed. Letby has joined the list of Angels of Death, sometimes known as Angels of Mercy, a type of criminal offender who is usually employed as a medical practitioner or a caregiver and intentionally harms or kills people under their care. The Angel of Death is often in a position of power and may decide that the victim would be better off if they no longer suffered from whatever severe illness is plaguing them. This person then uses their knowledge to kill the victim. In some cases, as time goes on, this behaviour then escalates to encompass the healthy and the easily treated. It's often said that the motivation for this type of criminal behaviour falls within mercy killers who believe that the victims are suffering or beyond help, though of course such belief is often delusional. In some instances it's sadistic. It's utilised as a method of using power, asserting that power, asserting control over helpless victims, as was the case, as I explained, with Lucy Letby and her sadistic streak. In some instances there is the malign hero or the fire starter and the fire extinguisher, a pattern wherein the subject endangers the victim's life in some way and then proceeds to save them. In some instances, the individual even knows that their victim is already dead and beyond help, but wants to create an image of selflessly saving them. Many of these individuals are pathologically disordered and are attracted to medical or related professions because it serves a purpose in relation to what drives them to commit these crimes. Those killers who occupy the role of a professional carer are sometimes referred to as Angels of Death, and in this role they might kill for money, for a sense of sadistic pleasure, for a belief they're easing the patient's pain, to assert control, maybe to draw fuel. In some instances it might just be because they can. I examined Lucy Letby, but there are plenty others of these Angels of Death. And what I'm going to do is, in a new series, analyse each of these individuals to help you understand why they did as they did. Because it isn't the case that every single Angel of Death behaves in a similar way in terms of the motivating factor. Yes, they harm. Yes, they kill. But what drives them to do that can actually vary. And therefore it makes for an interesting series to look at a number of these Angels of Death so that you can see their behaviours, the way that they conducted themselves, and compare what the outcome is in terms of what it is that drove them to do this. Are they narcissists? Are they psychopaths? Are they narcissistic psychopaths? Are they normals that had something else that was driving them, some alternative condition? Might they even have been empathic individuals that became broken empaths? I've chosen a selection that have differing driving factors so that we can examine that to extend your knowledge more generally, but also to address perhaps this peculiarity of individuals who are meant to be there to protect and to save, and yet kill. The way that the series will be done is that each one will be taken in turn, and rather than having an elongated analysis of each one, it will be a more abridged version because I'm going to be covering several of them. The same standards of rigorous examination of the evidence will have taken place, but rather than take you through many parts, I'm going to have a smaller number of parts per person to give you a flavour of what their life was, highlighting the key components for that, before giving you the conclusion as to what they are. Ahead of doing this, let me introduce a little of the individuals that we will be examining. First of all, there's Beverly Allitt. She's an English serial killer who was convicted of murdering 4 children, attempting to murder 3 other children, and causing grievous bodily harm to a further 6 children. Her crimes were committed over a period of 59 days between February and April 1991 in the children's ward at Grantham and Kesteven Hospital, Lincolnshire, where Allitt was employed as a state-enrolled nurse. She administered large doses of insulin to at least 2 victims, and a large air bubble was found in the body of another, but police were unable to establish how all the attacks were carried out. Similar modus operandi to that of Lucy Letby. Her victims were Liam Taylor, who was aged 7 months old, and he was admitted to the ward for a chest infection. Timothy Hardwick, who was aged 11 years old. He suffered cerebral palsy and was admitted to the ward after having had an epileptic seizure. Kaylee Desmond, who was aged 1 year old. She was admitted to the ward for a chest infection. Allitt attempted to murder her, but the child was resuscitated and transferred to another hospital where she recovered. Paul Crampton, who was then aged 5 months old, he was also admitted to the ward for a chest infection. Allitt attempted to murder him with an insulin overdose on 3 occasions that day before he was transferred to another hospital where he recovered. Bradley Gibson, who was then aged 5 years old, he was admitted to the ward for pneumonia. He suffered 2 cardiac arrests as a consequence of Allitt administering insulin overdoses before he was transferred to another hospital where he recovered. Yik Hung Chan, who was then aged 2 years old, admitted to the ward following a fall. He suffered an oxygen desaturation attack before he was transferred to another hospital where he recovered. Becky Phillips, aged 2 months old, admitted to the ward for gastroenteritis. She was administered with an insulin overdose by Allitt and died at home 2 days later. Katie Phillips, then aged 2 months old, the twin of Becky, she was admitted to the ward as a precaution following the death of her sister. She had to be resuscitated twice after unexplained apneic episodes, which were later found to be due to insulin and potassium overdoses. Following the second time where she stopped breathing, she was transferred to another hospital, but by this time had suffered permanent brain damage. She also suffered partial paralysis and partial blindness due to oxygen deprivation. In a twist of fate, her parents had been so grateful to Allitt's care of Becky that they had asked her to be Katie's godmother. Claire Peck, aged 15 months old, admitted to the ward following an asthma attack. After being put on a ventilator, she was left alone in Allitt's care for a short interval, during which time she had a cardiac arrest. She was resuscitated but died after a second cardiac arrest, again following a period where she was left alone with Allitt. In May 1993 at Nottingham Crown Court, Allitt received 13 life sentences for the crimes. Mr. Justice Latham, sentencing, told Allitt that she was a serious danger to others and was unlikely ever to be considered safe enough to be released. She's detained at Rampton Secure Hospital in Nottinghamshire. Christine Heather Gilbert is an American serial killer and former nurse who was convicted of 4 murders and 2 attempted murders of patients admitted to the Veteran Affairs Medical Center in Northampton, Massachusetts. She induced cardiac arrest in patients by injecting their intravenous therapy bags with massive doses of epinephrine, commonly known as adrenaline, which is an untraceable heart stimulant. She would then respond to the coded emergency, often resuscitating the patients herself. Prosecutors said Gilbert was on duty for about half of the 350 deaths that occurred at the hospital from when she started working there in 1989, and that the odds of this merely being a coincidence was 1 in 100 million. However, her only confirmed victims were Stanley Jagodowski, Henry Hudden, Kenneth Cutting and Edward Squara. On March 14, 2001, a federal jury convicted Gilbert on 3 counts of first-degree murder, 1 count of second-degree murder and 2 counts of attempted murder. Though Massachusetts doesn't have capital punishment, her crimes were committed on federal property and thus subjected her to the death penalty. Prosecutors, in an attempt to secure a penalty of death, sought to admit evidence of aggravating factors during the penalty phase, including Gilbert's 1998 conviction for the bomb threat. On March 26, 2001, the jury recommended a sentence of life imprisonment. On March 27th, the judge formally sentenced Gilbert to 4 consecutive life terms, without the possibility of parole, plus 20 years. She was later transferred to FMC Carswell in Fort Worth, Texas, where she has remained ever since. She will be the second angel of death that we'll be examining. Eino Nikopkoski is a Finnish serial killer. She worked as a nurse and was found guilty of killing 5 patients and the attempted murder of 5 more. Between 2004 and 2009, she worked at a range of hospitals, care homes and patients' homes. There, she killed 5 elderly patients using sedatives and opiates. She was apprehended in March 2009. She was tried in Helsinki District Court in December 2010 and pleaded not guilty, though the court convicted her. She was sentenced to life in prison, a minimum of 12 years before likely pardon. The sentence was upheld by Helsinki Court of Appeals in March 2012. Supreme Court of Finland dismissed her leave to appeal in November 2012. In May 2020, the Helsinki Court of Appeal rejected her parole application. She had requested to be paroled in March 2021, when she would have served the legal minimum of 12 years. She went after elderly patients. Is there a difference in her doing that compared to the others, such as Letby and Allet, that sought out children? She will be our third to be examined in the Angels of Death series. Next, Victorina Chua. In 2011, a series of deaths occurred at the Stepping Hill Hospital in Stockport, Greater Manchester. The investigation was sparked by a nurse on a ward at the hospital who noticed that several patients on the ward had unexpectedly low blood sugar levels. An investigation suggested that a number of saline ampules and saline drips had been contaminated with, yes, once again, insulin, and this was believed to have lowered the blood sugar levels in the patients. Insulin is a hormone produced by the pancreas to allow the uptake of glucose in the blood to be used by the muscles and cells of the body for energy. The brain requires a constant supply of glucose in order to be able to function properly. As insulin lowers the level of glucose in the blood, if too much of it is present in the circulation, this can quickly lead to lowered blood glucose levels, commonly known as low blood sugar or hypoglycemia, which, as a consequence, negatively affects the functioning of the brain and central nervous system. This can be rapidly and irreversibly fatal if not recognised and treated early enough. At Stepping Hill, it was suspected that due to the increased levels of insulin in the patient's bloodstreams, they quickly became hypoglycemic, and 3 confirmed fatalities occurred. 3 patients' deaths, 2 elderly men, George Keep, 84, and Arnold Lancaster, 71, and a woman, Tracy Arden, 44, were attributed to the alleged contamination, although it was also reported that each of the patients also had underlying medical conditions that made them weaker. On the 21st of July 2011, it was confirmed that 2 more patients' deaths were being linked to the investigation, bringing the death count to 5. Greater Manchester Police announced that the inquiry into how saline solutions had been contaminated with insulin would form the basis of a murder inquiry. During the investigation, 60 detectives were involved in determining how and when the saline solutions were contaminated. Meanwhile, a number of armed police guards were stationed at the hospital, and staff were made to work in pairs when administering medication to patients. On the 29th of March 2014, Victorina Chua was charged with the murders of Tracy Arden, Arnold Lancaster, and Alfred Derek Weaver, and 31 other offences, including grievous bodily harm and attempted poisoning. He was remanded in custody to appear at Manchester Magistrates Court later. The prosecution argued that he had decided to take out his personal frustrations on patients for reasons truly only known to himself. We will, of course, be examining what those reasons were. On the 18th of May 2015, Tudor was convicted on 2 counts of murder. He was found not guilty of murdering Arnold Lancaster, who had been suffering from terminal cancer, but was convicted of attempting to cause him and 20 other patients grievous bodily harm with intent by poisoning. He was also found guilty of 8 offences of unlawfully administering or causing to be taken by another person any poison or destructive or noxious thing with intent to injure, aggrieve or annoy, or attempting to do so, after deliberately altering prescriptions. The jury at Manchester Crown Court had deliberated for 11 days. Mr. Justice Openshaw sentenced Tudor, a Filipino national, to life imprisonment with a minimum term of 35 years, meaning he will be 84 years old when he becomes eligible for parole. Our next angel of death, Harold Frederick Shipman Jr., will be well known to many of you. He was known as Fred Shipman, an English general practitioner and serial killer. He is considered to be one of the most prolific serial killers in modern history, with an estimated 250 victims. On the 31st of January 2000, following being charged with the murders of 15 women by lethal injections of diamorphine, all between 1995 and 1998, and after 6 days of deliberation, the jury found Shipman guilty of 15 counts of murder and 1 count of forgery. Mr. Justice Forbes subsequently sentenced Shipman to life imprisonment on all 15 counts of murder, with a recommendation, like Lucy Letby, that he be subject to a whole life tariff, to be served concurrently with a sentence of 4 years for forging Grundy's will. 2 years later, Home Secretary David Blunkett confirmed the judge's whole life tariff, just months before British government ministers lost their power to set minimum terms for prisoners. While authorities could have brought many additional charges, they concluded that a fair hearing would be impossible in view of the enormous publicity surrounding the original trial. Furthermore, the 15 life sentences already imposed rendered further litigation unnecessary. Interestingly, Shipman became friends with fellow serial killer Peter Moore while in prison. Shipman denied his guilt, disputing the scientific evidence against him. He never made any public statements about his actions. His wife, Primrose, maintained that he was not guilty, even after his conviction. Note the similarity there with Lucy Letby's friend, who maintains that she is innocent. Shipman died by suicide, by hanging himself in his cell at HM Prison Wakefield on the 13th of January 2004, aged 57. Our next angel of death is Niels Hogel. He is a German serial killer and former nurse who was sentenced to life imprisonment, initially for the murders of 6 patients and later convicted of a total of 85 murders. Estimates of Hogel's alleged victim count have increased since his first conviction. As of 2020, he was believed to have claimed 300 victims over 15 years, making him the most prolific serial killer in the history of peacetime Germany. The next to be examined will be Efren Saldivar, who is an American serial killer who murdered patients while working as a respiratory therapist at Adventist Health, Glendale, in Glendale, California. Whilst working there, he killed his patients by injecting a paralytic drug, which led to respiratory and/or cardiac arrest. These drugs could have included morphine and succinylmethanonium chloride, as they were found in his locker with fresh and used syringes. Pavulon was used in 6 murders. This drug is used to stop a patient's respiration when they are about to be put on a medical ventilator. Saldivar was careful in the selection of his victims, choosing those who were unconscious and close to death. This led to no easily detectable rise in the rate or distribution of patient deaths when he was on duty. This, in turn, hampered the investigation, as there were no easily discernible correlations between changes in the distribution or rate of deaths and his shift pattern. His employment was ended on the March 13th, 1998, and shortly afterwards he confessed to 50 murders, a confession he later retracted. In searching for evidence that would be strong enough to obtain a conviction, police exhumed the remains of patients who had died while Saldivar had been on duty and had been buried rather than cremated. The marker that was being sought was unusually high levels of pavilon in the corpse, as this drug remains identifiable for many months, which contrasts with morphine, which composes into innocuous compounds relatively quickly. Police selected 20 bodies to exhume out of a total of 1,050 patients who had died at the hospital during his shifts. After the exhumations, 6 cadavers had evidence of a lethal concentration of pavilon. The medical records of these patients show that pavilon found in their bodies were not prescribed to them by a medical professional. On March 12, 2002, Saldivar pleaded guilty to 6 counts of murder and received 7 consecutive life sentences without the possibility of parole. He's incarcerated at California State Prison. Our final individual who will be analysed in this series of Angels of Death is Arnfinn Nessert, who's a Norwegian former nurse, nursing home manager, and a convicted serial killer. His crimes include the murders of at least 22 people, as well as attempted murder, document forgery, and embezzlement. So a real wrong 'un. He may have murdered up to 138 people. During the summer and the autumn of 1981, a series of suspicious deaths were uncovered at the Orkdal nursing home that Nessert managed. When questioned by police, he initially confessed to the murders of 27 patients, whom he claimed to have killed by injecting them with succinylmethylamine chloride, a drug to paralyze muscles, similar to that in terms of the behaviour by Efren Saldivar. He was charged with 25 counts of homicide, but later retracted his confession and denied all charges for the rest of his 5-month trial. He was convicted in March 1983 of poisoning 22 patients, and he was also convicted of 1 count of attempted murder and acquitted on 2 other counts. He was sentenced to 21 years in prison, the maximum term then available under Norwegian law, to be followed by 10 years of preventative detention. However, he was released after 12 years for good behaviour and 10 years of supervision. He's now reported to be living in an undisclosed location under an assumed name. The chief prosecutor at his trial, Olaf Jackelin, described Nessert as an ambitious man who wanted complete control over life and death of his victims. 8 angels of death, some men, some women. Differing methods utilised in terms of the drugs that were used, but similarities in terms of poisoning the victims and doing so in a medical environment. Not all of these individuals are the same, however, and we are going to examine each individual to look at their lives, what they did, and to explain to you what they are, utilising that baseline characterisation. Are they broken empaths? Are they normals with some other condition that has caused them to behave this way? Are they pure narcissists? Are they pure psychopaths? Are they narcissistic psychopaths? Or might there be something else that has caused this? It will be fascinating to look at the evidence, to make the determinations, but also to enable you to see the similarities and also, importantly, the differences between these individuals. So make sure that you remain alert for notifications about H.G. Tudor's Angels of Death series. Thank you for listening.